Okay, we are now recording. So when we get done here, and let me make a note here. I have a terrible memory. What I'll do is I'll put this link up on our YouTube channel, and then I'll send you a link to it so you'll have it. Okay, I'm going to go down to our USA Public Health demo site here, go over to the groups, and then so you guys will be looking at the FAB Reaccreditation 2022 local. So this is the plan. Um, the accreditation process is the beginning, so you're going to walk through all the different steps through the process. These last two are your annual reporting, and then your next step in reaccreditation in there. Where you get really into the base of the plan is the domains. Under the domains are the standards. Under the standards then are the measures, and this is typically where the documents go. And then the activities are, what do I need to do to accomplish the measure in here? And in addition, at the goal level here, we've built in the data source link right back to the FAB website. So this is should be standard 1.1 documentation on the FAB website right here. Yeah, so there it is. So if you need to get, reference the basic documentation, it's built right into there for you. But here's what we typically do to get you going is each objective and activity has got a lead. Now that is typically in this plan is the domain manager. So you guys, I'm assuming, have assigned people to each domain.
Not yet. We will be.
Okay, when you do that, let me know, and I can push all the way down to the objective and the activity level, the domain leads. And then secondly, what we do down at the activity level is we're going to set the beginning and ending date. We typically kind of recommend that the ending date is when you're planning on final document submission, maybe a month before that, give you a little leeway in there. And then you kind of pick a beginning date, which could be today or whatever you want to start it at. So beginning and ending date in here. And then as you're going through the activities, you're going to mark the percent complete and use the traffic lights kind of any way you want them. If it's on track, typically it's green. And a lot of people in this plan, when it's completed, you're going to mark it as gold. So you can go through and look at it, say, this is all done. Don't have to worry about it. All your documents are typically managed here at the objective level. So in this case, we're looking for a community health assessment. Click on here, and here's your different versions of the community health assessment. And when you're using document management for this particularly, we kind of recommend that you use the yellow light as a draft, and you have as many drafts as you want. The green light is completed within the department, ready to submit to FAB. And then the gold bar would mean we have submitted up into the EFAB system. So if you use those traffic lights, then it becomes very easy to monitor your status just with the traffic lights in there. Make sense?
Yes.
And then you can have a full report of the entire plan. You can have simply build a VMSG public page to give you this traffic light status on everything. There's a dashboard specifically for that plan. So you got lots and lots of tools to work with that plan.
Okay, thank you. Once we have access to that, we can have a separate conversation internally and see if this is something we would want to use and how easy it is for other members of staff.
Yeah, the nice thing about it is once you assign everybody as the objective and activity leads, then they get the automated email notifications to go in when it's time to update their portion of it. So to add the documents and update the plans and that sort of thing.
Okay, thank you. That's helpful.
Yeah, as soon as we're done here, I'll put that plan on your system and I'll email you guys and let you know.
Thank you, Fred. And then the second agenda item was seeing how the VMSG system can link in with another software package. Maribel, is that right? Have I got that right? So does it?
Particularly?
Sorry, Fred, I lost you.
Well, what were you wanting to link to?
Maybe a Qualtrics link or like a Qualtrics survey.
So this is a survey, an outgoing survey to people and getting the answers back. Is that what you're saying?
Yeah.
Yeah, we don't really have a link to that per se. Typically, the linkage is exporting the data from the VMSG dashboard to anything else. Now, if you have a results document for your survey, then you can attach it. So maybe you have an activity or an objective that says, by the end of February, complete Qualtrics survey 001. And then when you get the results back, you attach that as a document to the survey. Because a lot of it depends on exactly what you're doing with the survey, but there's really not a way to bring the survey in as potentially you could as activity results, something along that line. If you had something that you want to send over to me, I'll take a look at it and see what we can do.
Yeah, because we're trying to find another way to like collect data for our section goals. And so we're kind of testing out maybe if a Qualtrics form would be a little easier. And so that's why we're trying to see if if VMSG could somewhat connect with that Qualtrics form.
Well, you realize that VMSG has got the real-time planning built in, which is the tool to collect information from anybody, internal or external. So what you're going to do is down at the activity level or the objective of the activity level, you're going to assign the people like we talked about here. And then those people will get an email based on one of three criteria. Number one, have they been in the last 30 days and updated their information? Number two, do they have anything that has fallen behind schedule? And that's based on the beginning date, ending date, and percent complete. And number three, do they have anything that's overdue, meaning it's the ending date has come and gone and it's not yet 100% complete. So they'll get an email that'll link them right back into the specific objectives and activities that they've been tied to. So all that kind of tool is built right into the dashboard without having to go to a separate system. And I'll be happy to work with you to get that all put in there.
Would that work in terms of what we're looking for, Maribel and Brian and Gracie? I think we were trying to also not to duplicate tracking sheets as well. So, for example, we have a tracking sheet for workforce development. And for our future of public health funding and you know lots of different work streams. So we were seeing if instead of duplicating and double tracking, if it's possible to use this site to track some of that.
Absolutely. And what we actually recommend is, FAB has got what they call their 6-pack of plans, which is your workforce development, your QI, strategic plan, your CHIP, the 6 plans in there. That's where most people start, is you're going to start by getting your plans in there. And I see you guys have, let me go back to your organization here. Madera, there we are. Yeah, so you guys have got your CHIP in here, you got your strategic plan in there. Typically, you're going to have the rest of your 6-pack of plans in the system, and then everything's in one place. And then we have this tool called 3-dimensional planning, which allows you to interlink all of those. So within the system, you can say this strategic initiative is also related to this initiative on our CHIP and this one on our EOP plan, and that sort of thing. And again, we can train you on all of that stuff. Once you decide to go that route, it's easy to do. We just go through the training process and work with you to get everything tied together.
And then I had a question.
Yes, ma'am.
So I'm trying to gather like the graphics when it comes to the activity portion of each section, but I'm kind of confused on like how different the graphs look, because there's time frames and there's one that says raw, days, weeks,
Right.
months.
Let me show you that.
Yeah. I'm just wondering if you could go more into detail as to like what they mean. Does it mean like if a section's only reporting each quarter, or?
Well, you can have any time frame that you want. And apparently, I don't think you guys have been through the performance monitoring training yet. if you're asking that question, because we go through in great detail on that training. So there's an hour-long training session on performance monitoring. But let me just kind of give you the overview here. So I'm going to take you down into our little demo, tobacco program here. So we got the objective: reduce smoking at Wayne High School by 25% by the end of the school year. Here's the chart right here. Click on that. So what I'm looking at right now is a date range. So I can say I want to look at a shorter date range. So instead of 24, I might say I just want to look at what happened in 2023. So these two date ranges, beginning and ending date. And then you mentioned this, the raw. Raw is every data point that's been saved. Days means one data point per day. So which doesn't happen very often. You may not be saving more than one data point a day. But let's say you have you're saving data every week, and you want to look at just one data point per month. So if I select that, then I got to say which data point do I want during the month? The last value, which is typical in an increasing chart like this, or the average value for the month. So those are your things that you can set up here to customize the chart. And then over here, the other one that you can set up is what's the vertical scale? Is it 110% of the highest value, or is it 100% scale? And again, like I say, we go through all of this in the performance monitoring training. So that's all in there.
And then the points are based off of each time someone enters in information, right? Like the date.
Yeah. In fact, if I go back here and show you, it's right here. It's the history file. So when I click on that, you'll see all of the data points that have been entered in here. So it shows you back in 8/15 of 23, Fred Erickson added with a green light an objective here, didn't have any notes, and it was at a 0%. And then these are the data values that are charted in there. So you can add data points, you can remove data points, you can move them around as far as dates go if you wanted to add external data points in there.
How would you do that?
Real simple.
Adding in different dates?
Okay, if I right here, so I've got this one. You see the date appears down here. I can change the date. Let's say you had a data point back in 2022 that you wanted to add in here. So what I'm going to do is I'm going to go back to my activity. I'm going to change the values here to what they were back in 2022. So maybe it was a 5% reduction and somebody else was the objective lead, whatever it happens to be. I'm going to save it. And then I'm going to go to the history file here, and it'll be the top value because it's the latest value. I'll click on the date. I'll go down here and change this to 6/30 of 2022, hit the save button. It moves down to the bottom and becomes the leftmost point on your chart.
Oh.
And
yeah, because I was coming into that issue. Some people were putting in like data 3 times for the same date, so my graphs looked off.
Yep.
But okay.
And the other button down here is let's say I do that. Let's say I have 3 duplicate records. Now, if you're entering a duplicate record, you'll get a warning message saying, "Do you want to enter a duplicate record?" Sometimes you do, sometimes you don't. But let's say you accidentally had a couple duplicates. You can just click on this, hit the red X, it'll delete that history record.
Okay.
So you can add history records, you can delete history records, and you can change the date on history records.
Okay, that's good to know.
What else can I show you? So let me ask you a question. How much of the training have you guys been through?
Which training?
Well, we offer free unlimited training as much as you want. We've got the overview for everybody, which kind of is here's what the system's all about. Operational planning, a little bit of homework, and we do an operational plan review. Then we get into the performance monitoring, which is all these charts and graphs, and the VMSG public, being able to create the public web page with all the traffic light information on it. And then we go into the 3-dimensional planning after you've been in there for a while and got some plans in there to how to link them all together. And then for those of you who are designated administrators, there's about a 30-minute administrator training, how to manage permissions, users, that sort of thing.
So I feel like we've gone through all of them.
Okay.
But it's just really helpful for you to saturate the message when it comes to like very focused activities and we're in the moment actually like completing reports.
Great. Like anytime you need help doing that, just pick up the phone and call or email me or whatever. We can set up one of these go-to meetings real quickly.
Thank you so much for being available. Y'all are really good and responsive with technical assistance needs. So thank you.
Oh, thank you. Appreciate it. What else do you want to see?
I think you've covered most of my questions. Mine was mostly about the reaccreditation and then linking the software packages. But I don't have any other questions.
I'll tell you what, if you have an example of the Qualtrics survey that you want, and something you can send over my way, send it my way. Let me take a look at putting it in the system for you as a VMSG plan. Because 99% of the time we can do that. It's all kind of the same thing, but then it's all built in. You get all the reports. You can build the web pages. You can do anything with it.
Okay, thank you. Did anybody else have any additional questions for Fred?
Yeah, I don't have anything else. Just wanted to see y'all and Andrea again.
Well, like I say, if you have any questions at all as you're going through it, something doesn't look right, just please, pick up the phone or email me or text me or whatever.
Will do. Thank you so much, Fred.
Okay, you guys have a great day. It's good to see you all.
Thank you. Take care. Bye.
You.
Bye-bye.